Okay, so good evening all. So today we have Dr. Ishan Kumar from 2005 batch amongst us, who will be talking on a very interesting topic titled Radiology, the art of looking into human body. So thank you, Isanda, for taking your time from your busy schedule for this session. So just a brief introduction about the speaker. So Dr. Ishan pursued MBBS at BHU and later on did MD in radiology from the same institute. Further, he did a senior residency in body imaging and interventional radiology from uh, PGIMER, Chandigarh. Currently, he is associate professor in Institute of Medical Sciences, Banaras Hindu University, where he teaches and practices as a faculty member. So today we have this golden opportunity to learn from his experience, and we will certainly gain something from this session. So please, just I would now invite Isanda to start his session.
Thank you, Satyam, for your kind words and introduction. And I thank Ritesh and other organizing members for this opportunity. So the topic is radiology because that's what I do. Um, so first, briefly, I'll tell the timeline. I did join RK Mission Devghar in '97, and it was the Platinum Jubilee year. And I continued till 2005 when I passed class 12. And in 2005 only, I joined MBBS in Banaras Hindu University. I did MBBS and MD radiology from there only. Then I joined Chandigarh PGI as senior resident. And then in 2015, I joined BHU again as assistant professor. And now currently I am associate professor in this very department. So about the stream radiology, it's a very lucrative branch of medicine. Before joining MBBS, I did not know what radiology is. I did not know about this subject. But as you can see, this is the 2017 and 19 cutoffs. Uh, Almost every year, the top rankers pursue radiology, evident by the closing ranks, and followed by dermatology and pediatrics and medicine and other branches. But with some exceptions, mostly toppers all over India choose radiology because, first of all, it is less hectic compared to other branches, and money is good if you want to pursue in that way. And most importantly, it is very interesting because in a hospital, in a big hospital such as ours, which is 2400 bedded hospital, uh, 80 to 70 to 80% of diagnosis is made by the radiologist only. So radiology is also known as eye of medicine. We have various techniques which we use to look into the human body. I'll describe the specifics. Uh, Traditionally, it was defined as the science dealing with X-rays and other high energy radiation, and amongst other imaging techniques such as ultrasound and MRI for the diagnosis and treatment of disease. And it began with the discovery of X-ray in 1895. This person over here is Wilhelm Conrad Roentgen. He discovered X-ray. He discovered a new kind of ray when he was experimenting with cathode ray tube. And this photograph is of his wife, and this is one of the most X-ray image or most famous X-ray image in the history. His wife Bertha, he took the X-rays and submitted the paper and presented it in December 1895. And after presenting the paper, he concluded by saying that all hell can break loose now. And indeed, all hell broke loose after that, because in 1996, a year later, there was 1006 publications on X-ray only. And it was taken up in a big way by the public, the Hollywood, and media, and Charlton's also. People began to think that it is associated with necromancy and hypnotism and all those things. Then gradually X-ray gained the popularity, and it served in a big way in the Great War, in World War I, because it before that there was no way to assess whether about the traumatic conditions of the body. So soldiers were injured, and with the help of X-rays, the physicians could easily detect the fractures. And now it seems like a very common thing, but at that time it was a massive discovery which resulted in reduction of casualties in World War One. Then other research came in 1946 by the discovery of nuclear magnetic resonance. Two American scientists, Purcell and Bloch, discovered the phenomena of NMR, which later translated into the discovery, the invention of MRI machines. Then in 1955, Ian Donald published the paper on abdominal masses, the use of ultrasound in abdominal masses, and ultrasound picked up. Then in 1972, this fellow also won a Nobel Prize for discovery of CT scans. So as you can see, there are variety of imaging modalities that we can use to see into the body. And these are the landmarks. And in 2012, International Society of Radiology recognized this day in honor of Wilhelm Conrad Röntgen as International Day of Radiology on November 8th. So there are broadly two specialties of radiology. One is diagnostic radiology, which we use these techniques for recognition of diseases. And the other is interventional radiology. We use the radiology techniques for the treatment of diseases under image guidance. So for diagnostic techniques, we have X-ray, we have fluoroscopy, CT scan, angiography. Then we have reflection images. We transmit the rays to the body and it gets reflected from the organs in different way. And we use that to map the information and generate images. Reflection imaging is used in ultrasound and color Doppler ultrasound. Then emission imaging is MRI and PET scan. Now, this is the conventional X-ray tube. I will not go into details. What happens is the heat is given to this cathode, and which leads to electron flowing from cathode to the anode. It hits the anode at a very high speed, which leads to generation of X-rays. Now, these X-ray pass through the body. Different tissues of the body react to X-rays in different way, and the amount of X-ray that passes from the body leads to generation of image. Now, this is the father of X-ray, Roentgen, and so when the X-ray was discovered, soon the X-ray fever developed all across America, because a scientist called Thomas Edison, he turned the Roentgen's finding into a market success. He was of the opinion that people like Roentgen will expend their lives in the labs and won't earn a penny out of it. But Thomas Edison was a good businessman, so he staged a special road show on Roentgen rays or X-rays, and he staged this device, and the various people came. They could take the X-ray of own bodies. Now his road show went into Russia and Portugal. So the Tsar and Tsarinas of Russia also took their own X-rays. So what happened, that money started flowing in for the research and development of further superior machines. This is the photograph on the left side. You can see that the showrooms of shoe companies, they started keeping this shoe fluoroscopy, in which a person can try a shoe and take the X-ray of shoe, and to show that their fit is properly fitted into the shoes. So this was a marketing gimmick. At that time, no one knew that X-ray can cause harm also. It was taken up in Superman and James Bond movies also. James Bond used to have that goggles which he could use to get the X-rays of the villains, and Superman also started having X-rays vision. So it was taken up in a big way, and that helped in the funding of the research. Now, Edison was doing this road shows, and he terminated this road shows in 1904 because his assistant died of burns caused by X-ray. Some suspect that he actually died of cancer that was due to ill effects of X-rays. What happened that in bill was passed in New Jersey that no one should use X-ray in opera because they feel the actors felt exposed by the X-rays. The hypnotic effects and necromancy session was ascribed to X-rays. Some alchemists, they claim that if we radiate a base metal material for 3 hours, it will turn into gold. And it was published also in early 1900s. X-ray research led to various Nobel Prize. This is Max von Loo. He showed that X-ray is electromagnetic wave that formed the basis of X-ray crystallography, which was used by Watson and Crick to discover the double helix model of DNA. Again, these two scientists also got a Nobel Prize. So in modern medical science, how do we use X-ray? You might have noticed at the time of COVID that X-ray was used massively in follow-up and diagnosis of COVID-associated pneumonia. And again, I told you that in World War I, the X-ray of bones was used very prominently to the benefit of soldiers who were injured in the war. So musculoskeletal X-rays and chest X-rays are the most commonly used performed X-ray. You can see this fracture of radius and ulna forearm bones, and here you can see the X-ray showing patchy opacity both sides. This was a case of COVID. Then fluoroscopy is a variant of X-ray that Edison used in his road shows. This fluoroscopy is imaging technique that uses X-ray to obtain real-time images. Suppose there is a blockage in your food pipe. We can ask the patient to drink a radio opaque dye, and then we can move the video as the dye goes through your esophagus and stomach to see where there is obstruction or not. It is very useful for early detection of esophageal cancer and stomach cancers. Then other uses of X-ray, it can be used in orthopedic surgery and even interventional radiology procedures to guide the treatment. Barium X-rays and edema. Barium is the radiopaque dye that we use for imaging of. This is the large intestine. You can see if the patient drinks this dye, barium dye, and we take the X-ray, you can see the large intestine is opacified very nicely. Then catheter insertions and manipulations, as you might have heard of coronary angiography and coronary angioplasty. X-ray techniques and fluoroscopy technique is used in coronary angiography. Then came the use of computed tomography. Now, computed tomography is also based on X-ray technique, in which the X-ray tube moves around your body. So this is a non-invasive medical imaging technique and uses specialized X-ray equipment. Now, what happens is, so this is the patient lying on the table. If you can see my cursor, and this X-ray tube revolves round and round of this this patient, and out of the multiple projections are taken, and using computer generated image, we can see the cross-section images of the body. So this technique was discovered by the scientist named as Godfrey Hounsfield. He was a British scientist. And what happened, this is a picture of Hounsfield taking Nobel Prize from King of Sweden. And this was a stamp issued in his honor. Mistakenly, the stamp was named after the W.C. Roentgen, but actually photo was of Hounsfield. So in 1962, the Beatles, the music band, had their first recording session with Electrical Music Industries, EMI. So this money generated by the record sales enabled the basic science researchers to thrive in a cash-rich environment. So the money gained by the sales of that EMI that Beatles had recorded. This money funded the research of Hounsfield, which led to discovery of CT scan. So it all comes down to music. So what happens is this: there is rotating X-ray tubes, and many different snapshots are collected in one during rotation. Modern day scanners, the one we have in our hospital, that this tube rotates about 300 times in single second. So the image data is sent to a very highly specialized computer, and cross-sectional images are obtained. So you can see in brain trauma, we can see it is used to diagnose various hemorrhages in brain and various conditions such as stroke and brain tumors. Then CT is used to guide the interventions. Here, the image showed that there is a tumor in right side of lung, and we use this X-ray to put a needle into the tumor and take a sample that can be seen under microscope and diagnose which type of tumor it is. In abdomen, we can see there is these dark spots are actually representing various cancers in the liver. So this is liver, this is stomach, and the spleen shown by the CT scan. In chest, we can see that X-rays, coronary angiography is used to non-invasively diagnose the blockage in your heart vessels. CT was broadly used in widespread use of CT was evident in the recent COVID pandemic. And this was our research, which we did comparing the CT scores in vaccinated and non-vaccinated subjects. So this research was published in European Radiology, one of our highest impact journals. So in this one, we can see this blue line represents that the score of non-vaccinated persons. Then this green line represents the score of partially vaccinated persons, and this yellow line represents the scores of completely vaccinated person. So in various age group, we can see that even in more than 60 years, the scores decreased as the vaccination status increased. And and similar trends was followed in lower age group also. We can see in less than 30 years of age group, the score is nearly zero in the persons who were vaccinated completely with 2 doses of COVID vaccines. Again, this was our research published in Journal of Radiology and Imaging. In this, we studied the role of CT in assessing the severity of chronic obstructive pulmonary disease using quantitative techniques. Word about because this is a modality that uses X-ray, there are some ill effects, and repeated CTs are not good because it leads to cumulative dose, and which can cause cancer. At least hypothetically, there are various research in Atomic Energy Regulatory Board of India prescribes that dose of 50 millisieverts should not be crossed per year. So one CT scan of chest or abdomen costs you about 5 to 10 millisieverts. So it will be advisable not to do more than 3 or 4 CT scans in a year, which people were doing at the time of COVID, just to see what is the status, which was not advised actually. These are the pictures of the cancers that is associated with the use of overwhelming use of X-rays. Then other modality that we use is ultrasonography. It has become a household name now. Everyone who has abdomen pain and anyone who is pregnant has to go under ultrasonography. How does it work? It is based on high frequency sound waves that are passed into the body, and these waves are reflected at the boundaries between different tissues and organs in the body. So using a known information about the speed of sound in the tissues, computer can generate images. And if a tumor or any pathology develops into any of the tissues, it will be detected easily on ultrasound. So the development of ultrasound into clinical use is attributed to two scientists. One of them is Ian Donald, which you can see. This is the picture of Ian Donald. There is a very prestigious fellowship named as Ian Donald Fellowship. Actually, he was a pilot in Royal Air Force in World War II, and he has a profound knowledge of radar and machinery used to detect signals. So what happened is that in 1912, Titanic sank, and in 1914, the research became funded for the development of sonar technique, which is sound navigation and systems, which led to the development of eventual ultrasound, which was used to detect industrial flaw in metal development in steel plants. In 1942, a scientist named as Dasik, he used ultrasound or hypersonography, he called, to locate the brain tumors and cerebral ventricles. There are ventricles in the brain, and which was seen by Dasik. In 1958, Ian Donald used pulse ultrasound in investigation of abdominal masses. He showed the women had a cancer of pelvis. She had a big 10 centimeter teratoma, who could be diagnosed using ultrasound, and the patient was saved. Due to that paper, the ultrasound came up in a big way. Every hospital started ordering it. Now about Ian Donald, he was in Royal Air Force, and he had received a gallantry decoration in Royal Air Force for rescuing a pilot from a burning aircraft, and while bombs were still within it. So this speaks volume about his character. He is a very prominent figure in our stream in radiology. It is very few of us has obtained the Ian Donald Fellowship, which is done in Europe. So we use ultrasound in various parts of the body, including eye. There is B scan, ophthalmic ultrasound. There is Doppler ultrasound, which is used to visualize blood flow, thrombosis of the blood, varicose vein. Then there is breast ultrasound, abdominal ultrasound. Any part of the body which does not contain air can be easily diagnosed on ultrasound. Air, because the sound travels faster in solid and liquid compared to the gases. So air containing tissues are slightly difficult to diagnose on ultrasound, such as lungs. We do not commonly image ultrasound on image lung using ultrasound, because unless the lung is filled with fluid. So this is our research which demonstrated the utility of contrast ultrasound in diagnosing the cancers of gallbladder. Now, gallbladder cancers are very rare in Western countries. In US and Europe, they see maybe one cancer, gallbladder cancer in a year. And in our setup in Gangetic Plain, we perform intervention procedures on 4 patients every day in gallbladder. So, and in our OPD, at least 50 patients come every day with diagnosed with gallbladder cancer. It is one of the most common cancers of North India. BHU and Lucknow, we are one of the prominent centers working on gallbladder cancer research. And still now we don't know why it is so common in this area. Maybe some researchers have shown the disease being affected by the water, somehow the high degree of arsenic in our water, and some say that use of oil in this region may lead to gallbladder cancer, but nothing is proven yet. So again, ultrasound we can use in neonates, young child less than 1 month or less than 6 months even, to diagnose the conditions of neonatal brain. So this was our research which was published in Journal of Perinatology, which is published by Nature Group, and which showed that the Doppler and ultrasound can use to detect hypoxic injury in the brain in patients who eventually develop cerebral palsy. Then one of the other modalities that we use to diagnose the condition is magnetic resonance imaging. Almost every hospital, every big hospital in the country has MRI techniques. Now, MRI uses a powerful magnetic field. We have 1.5 Tesla as well as 3 Tesla MRI equipment. Now, patient is kept under a very high field magnet, and we all know that our body is made up of hydrogen, water, and which contain protons. So while our body is kept into high field magnet, all our protons align in a direction of that magnet. Now we give radio frequency pulse to our body depending on which part of the body we want to image. So this radio frequency pulse is 90° to the existing field, and depending on the various conditions of the body, suppose there is edema or brain stroke, the water in those tissues react differently to that pulse, and this forms the basis of the imaging we generate, cross sectional imaging. The image quality of MRI, the resolution, the contrast resolution is better compared to all other modalities, but the drawback is time. While it takes about 15 seconds to obtain a CT, it takes roughly 20 minutes to get MRI of the patient of a brain. So MRI started with the discovery of rotating magnetic field that was discovered by Nikola Tesla. And gradually that discovery led to the development of MRI. Now in 1944, Isidore Rabi, he got Nobel Prize for his discovery. He discovered, along with the Bloch and Purcell, he developed a method for measuring the movement of atomic nuclei, and this was, he called it nuclear magnetic resonance. Then a scientist known as Paul Luther, along with Peter Mansfield, he developed a gradient magnetic field that would allow us to take two-dimensional image of the object. So basically, Mansfield and Luther wrote the theory of how an image can be generated, and a scientist known as Damadian, he developed a 1.5-ton machine called Indomitable. So he used his assistant to generate. His assistant was there for 5 hours inside this machine, and he used to he invented the first MRI machine. Unfortunately, Damadian did not get the Nobel Prize, and the other two who developed the theory did. But credit to the development of MRI goes to Mr. Damadian. Now, in current day scenario, MRI has widespread use. It can be used to diagnose conditions of brain which higher sensitivity and specificity compared to CT scan, spinal cord, spine imaging, orthopedic imaging, musculoskeletal imaging. The second image, you can see the red arrowheads. This points to a very small pancreatic head cancer, which was undetected by CT scan and other techniques. You can see this MRI of the wrist. We can see that there is a small erosions in the metatarsals, which was a sign of very early rheumatoid arthritis. Again, this was a very dense breast and very small breast cancers. Now, breast cancers have become a very important field for us because highest number of lawsuits for radiology in America are due to breast cancer. So this has become a very important field to diagnose the lesions early, and MRI is the modality of choice to diagnose early breast cancers. And even we have not published yet, but we are working on the capability of various sequences of MRI in diagnosing various molecular subtypes of the breast cancers. So that can easily tries the patient into whether which kind of chemotherapy they would receive and which kind of actually therapy module they will receive. MR angiograph can use to image various vessels and arteries and veins of the body, venous thrombosis and arterial aneurysms. So this was our research that was published in Asia Pacific Journal of Oncology. We did work on generating a artificial intelligence based model to detect the type of cervical cancers. We use various sequences, MRI perfusion along with diffusion MRI techniques. We fused the 2 or 3 MR parameters to detect whether a tumor is hypoxic or non-hypoxic, which is a very important demarcation because the hypoxic tumors do not respond to chemotherapy well. So at the early detection of hypoxic tumors and strengthening of chemotherapy would help these patients a lot. The other modality is PET scan, which stands for positron emission tomography. Now the PET scan is no more a branch of radiology. It has turned into a new branch called nuclear medicine that is separate from radiology now, but it started as a branch of radiology only. The next thing that we do, and personally I am very interested in this, is interventional radiology. It's a subspecialty which provides minimally invasive technique with the help of imaging modalities to diagnose or treat a condition. The applications are widespread. There are palliative procedures in cancers. There are vascular procedures, and this is done usually in sedation or local anesthesia. So 8 out of 10 procedures that we do uses skin incisions smaller than 5 millimeters, and 9 out of 10 procedures use only local anesthesia, sometimes with sedation. And up to 8 out of 10 patients go home the same day, especially in resource poor setting such as ours, when we don't have much bed for the patient. We discharge the patient within 2 hours of the procedure. There are various non-vascular interventions such as tumor ablation and tumor biopsy, image-guided collection of drainage abscess and drainage of pleural effusions and fluid in body. And there are this was our paper that was published. We showed that percutaneous delivery of biliary stent, the plastic biliary. Now, what common practice is that we do metallic stenting in patients of gallbladder malignancy. That metallic stent costs about 45,000, and it is because the gallbladder cancer patients do not have usually more than 1 year to survive. In our setup, 45,000 is a bit too much for a palliative procedure. So we tried to deliver this plastic stent in the patients of unoperable gallbladder malignancy, and this plastic stent costs about 700 rupees. So we showed that it is almost as much effective as the metallic stent, and this was published in Journal of Intervention Radiology. Then with the use of radio ablation, so there are tumors that are resistant to chemotherapy, drug therapy. There are some tumors that are resistant to radiotherapy, but no tumors or no tissue, no body part is resistant to actually frying. So with the use of ultrasound guided or CT guided ablation techniques, we use cryoablation, which we freeze that tumor. Then we use radio frequency ablation, where we give radio frequency wave and fry that tumor. And then microwave ablation, we just give microwave shocks to that microwave which we use in our kitchen, same thing, but higher power. So almost every week we do perform microwave ablation of the liver and other tumors, lung tumors also. Now, what is the role of radiology in cancer screening? Most cancers are initially detected by imaging techniques. So various screening programs have developed to diagnose cancers, especially in the population who is predisposed to cancer. If someone has a sibling or mother or father that had developed previously cancers, they can get screened themselves. Uh, Previously, chest radiograph, chest X-ray was used for cancer, lung cancer screening, but now it has been replaced by low-dose CT scan. Then widespread thyroid ultrasound screening has been popular in South Korea because apparently thyroid cancers are very common in those areas. Then barium screening have become popular in Japan because cancer of stomach is very widespread in Japan. Also, liver tumors are very common in South Korea and those area. So triphagic CT angiography is used for screening of liver cancers. In our area, we do, if a patient is diagnosed with gallbladder stone, we do recommend them to go screening routine 6. If they decide against the operation, we do want to screen them very regularly in 3 months or 6 month duration to look for whether the patient is developing gallbladder wall cancer or undergoing malignant change or any polyp is there. So breast cancer screening is very popular. Our government is running breast vans in remote areas to screen mammography. So mammography is a type of X-ray specially designed for breast, in which even very small nodules of breast can be picked up very easily, and there is less radiation compared to the X-rays. And post-treatment patients are kept under surveillance using CT scan after colorectal cancer, colon and intestinal cancer. What is the future of radiology research? Now, people are, as we told, we are working on the molecular genotypes of breast cancers. People have developed a MRI-based radiogenomics of the brain tumors, in which, based on imaging appearance, we can predict what kind of genetic defect is present in the tumor. That helps in prognosticating and treatment development of that particular tumor. Also, the area of focus in radiology is artificial intelligence, because the radiologists are very less and the demand is very high. The various companies have started pouring in with research about developing a software that can detect very small tumors, especially lung tumors and breast cancers, uh, with as much accuracy as a reasonable radiologist with reasonable experience. So we can see this lung cancer was detected with the use of artificial intelligence using deep machine learning, and this small breast cancer was detected with the help of this software. Although these softwares are not available to us in public hospitals and government-based hospitals, foreign countries are doing it because, of course, the price of radiologists is very high there. So, to summarize, radiology, radiodiagnosis, and biomedical imaging is one of the main pillars of comprehensive cancer care, and not only cancer care, in all the domains of various pathologies all over the body. The diagnosis is more often made by getting an investigation done, radiological investigation done. We can help aid the tissue diagnosis by taking biopsy and FNSE, and we can perform palliative and curative procedures on them under imaging guidance. Thank you for your patient listening. If any questions are there, I'll be happy to answer. This is the image of my institute. The first one is our academic building, the Institute of Medical Science. Then the second is the Centenary Super Specialty Block. And this is our old hospital, the third image. And fourth one is the trauma center of BHU, which is the largest trauma center in the country. Thank you.
Thank you.
Thank you so much, Mia. Very beautifully presented, actually. Uh, I have few questions. The first of them is so. So these some of these cancer detection techniques. So say suppose PET CT or so these are still very costly.
Yeah.
And how do so and you also showed us a number of radiological techniques that can be used for early cancer detection. So this cost barrier, so until and unless it becomes cost effective, how do we make it popular amongst people to get themselves uh, get go for a screening? So that is, so which of them have actually the potential to be adopted for some mass screening campaign? So for example, the government is has taken up the mammography. So are there any other such radiological techniques which are at the cusp of actually cost less and can be adopted on a wider scale, maybe through some government support?
Okay, very good question, Satyam. There is a lot of debate on which modalities can be used for screening, because the Western literature, what they if you see their researches, everything for everything they will prescribe a MRI and PET scan and CT scan even, because they want money to keep coming in. But of course we cannot follow that, because we'll lose our patients. पेशेंट हमारे यहाँ एक सीटी स्कैन कराने के लिए अपना ज्वेलरी बेच के आता है.
Hmm.
We cannot do that. So we try to formulate imaging protocol based on the patient. In our setup, what we do is ultrasound is very cheap. In our hospital, ultrasound costs about 200 rupees. In US, where my brother works, that same ultrasound will cost you about $40, and uh, or even more. And MRI in our hospital costs about 2,200 rupees, and in US, MRI will cost about $1,000. So still, even 2,200 is not less for our population. And we try to resort to ultrasound and X-ray and mammography and other cheaper investigations for common population screening. But if a person or a patient is at risk for developing cancer, suppose he is diagnosed with a syndrome, cancer predisposition syndrome, or his or her sibling or first degree relative is affected with cancer, we persuade him or her to undergo MRI or the investigations. Uh, that's a bit of dilemma actually, but still the patient obey. There is increasing awareness about cancer, and people actually abide.
So can you also just elaborate on the barium screening that you are talking about for stomach cancer in Japan?
Yeah, so
क्या हुआ बोल दिए चले गया क्या हुआ हाँ बोलो एक मिनट कहाँ गए
so in Japan, stomach cancer is very common. And stomach, because it is a gas containing thing, because it is communicating with mouth, we take usually air with our mouth. Ultrasound cannot be used for screening. And the best modality is for radiology, the best modality to see the lumen of the stomach is to ask the patient to drink a dye and then do a X-ray. And other thing is endoscopy. So because endoscopy is an invasive technique, it cannot be repeated again and again. So in what happens is for first sitting, we in Japan they do endoscopy along with barium, and then subsequently after 1 year or 2 year duration, they undergo barium swallow and barium meal follow-up for detection of, suppose there is a space occupying lesion in stomach, so that will cause a prominent defect in the barium pool, and that patient can be selected for endoscopy, following which the cancers can be detected.
So how costly is this procedure, and at what age one should actually, so suppose one of the first relatives of somebody has been diagnosed with stomach cancer, then at what age one should start screening this?
Actually, in India, we do not recommend barium screening because the probability is not that high. But if a patient starts developing dysphagia, that means you have some problem in swallowing the food, or you have repeated vomiting, or you have some episode of blood from vomiting, then we recommend barium. And the age is usually more than 40 years because we don't commonly see stomach cancer in less than 40 years unless he has some kind of genetic defect. So more than 40 years with symptoms, we usually recommend barium. And the price of barium in our setup is 230 rupees in BHU, and the patient brings that barium containing salt that is around 200 rupees also. So it's less than 500 rupees.
Okay. Any other queries from any other participants? So you might please go ahead.
Hi, Ishan.
Hello.
Gaurav here, surgery we met in Deoghar. Sorry, I missed your whole session. I was in the OT, actually just came to see you. My question would be the surgery questions to our assistant professor of radiology. All basic questions. One is what I want to ask is, what is your take regarding we as a general surgeons, we get a lot of patients with gallstones with deranged LFT, and then we are suspicious of CBD stone and everything. So now I see in tertiary care centers they have gone towards endoscopic ultrasound vis-a-vis MRCP. What's your take? What's your take on that? Endoscopic, the cost factor. I'm working in rural setup as well, so cost factor is a huge deterrent in terms of MRCP as well.
Okay.
So as a surgeon, if you are seeing a deranged LFT and a multiple gallstones or say sludge, you are worried about. Of course, you are worried about something in the CBD. So what's your take? Basically, number one is MRCP vis-a-vis EUS, and what is being practiced in BHU.
So what we do in our setup, obviously our patients are same as your setup. So
Yes.
patients are usually very poor, and
Yes.
they cannot afford MRCP. Even if our MRCP is 2,200 rupees only, but
Okay.
in most of the cases they cannot afford. So we go with a combined assessment of alkaline phosphatase and CBD lumen caliber on ultrasound. If the lumen is 6 millimeter or more and it is associated with high alkaline phosphatase, we can do MRCP. If we try to diagnose it on ultrasound, if we see CBD calculus well and good, we take the patient straight away for endoscopy and ERCP.
Endoscopic ultrasound, is it there at BHU?
Yes,
Endoscopic,
yes.
okay,
Endoscopic
yes.
ultrasound we do, but we prefer first MRCP if
Okay.
there is dilated duct, if there is dilated CBD as well as dilated pancreatic duct, and even if we cannot make out whether there is any tumor or not, but the indirect signs are there, then we do endoscopic ultrasound. Another indication is for taking a biopsy, because percutaneous biopsy we do not take because it can lead to upstaging of the tumor. So endoscopic ultrasound is used usually for biopsy or
Okay.
for diagnosing
Perfect.
a very occult cancer.
Perfect. Now the second, there is no second question. Second is a catch which I need to give you. One of my friends is at BHU. He is doing DM gastroenterology. His
Okay.
name is Dr. Ram Gattani.
Okay. Okay.
So he has told me, when I told him about you, he told me, दादा दोस्त एक कैच मार देना, अपना जूनियर है वो जाके थोड़ा सा रेडियोलॉजी पढ़ूंगा मैं उससे गैस्ट्रो रिलेटेड. So he will come to you. His name is Ram Gattani. He is doing DM gastro at BHU.
Sure.
ठीक है, तो मैं बोल दूंगा तुमसे बात हो गई है फिर.
Nice to know.
हाँ, ठीक है, चलो continue guys. Thank you, Ishan. Thank you for your answer.
Thank you. Sir.
Thank you.
So there was something in the chat box also. So Abhishek Kumar, from 2001 batch, has actually commented that your comments on making USG, a portable USG, available in rural areas for detecting screening abnormalities in pregnancy. So considering legal aspects, so
Hi Ishan, अभिषेक बोल रहा हूँ. I think ये मैंने डिस्कशन भी किया था, आई होप तुम्हारे साथ एक बार.
Actually, it has become a medical legal nightmare. These portable ultrasound usually it came up in a big way in early 2000s and when everyone started keeping it. But what happened that people were indulged in illegal sex determination of babies. So because that was an issue and that's an illegal thing. So it is currently not permissible to do a portable ultrasound in rural setup. It is only permitted within a hospital premises. We do have portable ultrasound, but we cannot take it out of our hospital because people started doing gender determination and female feticide. That was a nightmare. So government has currently prohibited it.
So, तुम्हारे हिसाब से, when do you think we can overcome these issues? And because I think it's really very important to control the death rates and the abnormalities that are happening, considering
Yeah.
the public health aspect.
Yes, no, actually, this is a two-edged sword. This is a facility that can used by good people also and those indulging in illegal activities also. So I think time will tell only. If you ask me this question 10 years down the line, maybe I'll have a definitive answer.
So, any alternative method or any alternative diagnostic method or maybe a process, some legal, मतलब कुछ भी ऐसा जो कि which can be used to make it possible.
PLC laws are actually very stringent and very irritating for us also. We have to do a lot of unnecessary documentation, and I think only bureaucrats may solve the things, but it's beyond our control as of now.
Okay, Ishan, thank you.
Any other queries?
Hi, Ishan, this is Nitin from the 2001 batch.
Hi, Dada. How are you?
And I'll pitch in for both you and Abhishek. So for past 2-3 years, I am working in the tribal areas. And obviously, this is a huge issue, this portable ultrasound. This is a requirement as well as a necessary, it's a necessary evil. Because, for detection of breast cancer, I'm saying it's a huge issue out over here, especially in areas like districts bordering Bengal, like Purulia, Saithia. It's a huge issue. But again, government deployed some vans with this portable ultrasound machines and all. And I don't know, Abhishek, this is for you also. They were charging 500 rupees for sex determination rather than doing their own job. So I don't know how this issue will be solved, but it's a huge issue because
more than medical one, I think.
Yeah, true. It's a social issue, and also ethically also it's like
It's an administrative issue as well.
yeah.
Very difficult.
So
So there is a question from Vikas. I wanted to know whether data analytics and machine learning are used in India in radiology. And can you please tell some problems with which they are trying to solve using them? Okay. As I told you, the artificial intelligence has come up in a big way. Deep machine learning and data analysis is currently done in almost every big cities in India. Where a variety of the softwares, one of my friends is also has opened an artificial intelligence software company. Currently, the focus of research is on early cancer detection, especially lung cancers. We are working with people in IIT BHU as well as IIT Gandhinagar in diagnosing early, that they are trying to develop a software for detection of early cancers of lung. And because it needs a huge amount of data, they need like 50,000 CT scan of chest with and without cancers. So a problem which we face in our setup, that many of our patients, knowingly or unknowingly, they have developed tuberculosis in the past, and tubercular nodules are very similar to early cancer nodules. So maybe with further enhancement of software and strengthening of data using various thousands of scans, we will be able to solve this dilemma, and we may come up with a software that can do the job as well as the radiologist. So lung cancer and breast cancer, these two are the focus of research currently. And yes, I am also collaborating with PGI Chandigarh people in artificial intelligence software that can detect early thickening that may be suspicious for gallbladder cancers. So yeah, I think these three are the areas that currently we are working on.
I think we don't have any more questions for the day.
Ishan.
Yeah, please go ahead.
Yeah, Ishan, Gaurav here again. I'm sorry. Just one thing which I wanted to ask, that somebody was telling me, is there any upgrade or update on mammography for screening of breast cancer? Like, is there like something which has come up new in that, in sense?
Yeah. So
Yeah.
there are various techniques of or refinements of mammography.
Yes, please update. Yeah.
Spectral mammography has come up in various hospitals. We currently do not have it. And then contrast enhanced mammography has come up, which is also a costly technique. Actually the main problem is price.
Right.
So because most of these equipments are imported, these they cost a lot, and for screening we have to have a cheap modality. So
Right.
yeah.
Okay. So thank you. I just wanted. Sorry, Zulu sounds like a radiology class, but then again, we don't get this opportunity too often.
No problem, sir. No problem.
No problem. Thank you so much. Thank you.
We are used to collaborating and discussing things with surgeons on day-to-day basis.
Of course, it goes without saying. But nowadays radiologists are so busy from running from one center to the other. It's difficult to find their time.
Yeah.
Yeah. So thank you for the update. The rest of the update, I'll take you on a personal message if need be.
Gaurav, you have always the privilege of catching Ishan anytime.
Yeah, Abhishek, what?
We have always the privilege of catching Ishan.
Yes, of course. We are very proud of him. He's going to be the next HOD of radiology there, if everything goes well.
Fingers crossed.
Yes. Thank you, Shan. Thank you so much.
Thank you.
Okay. Thank you, Ishan, for your time. And I think we don't have any more questions, and we will call it a day. Thank you once again for your time. And I think the session will be uploaded on YouTube. So in case anybody who did not join, they may actually catch up on the recorded session. So thank you all for your time, and good evening to all.
Thank you everybody.